Hi, Dr. Mohebi from Personal Mohebi Hair Restoration. We are presenting another FUE case of 2,000 grafts. We're going to use ARTAS today. We'll be using a robotic system to extract grafts from certain areas of the scalp, and for some other areas we still may use manual technique. On the mid-scalp and corners and front too, and we're going to restore the hairline and go behind it and add all the sides. We focus mostly on the front and corners. That's going to be 2,000 grafts, which is going to be adequate to make a hairline. Hairline that's going to be more solid. We're going to put some more hair on these top areas that is pretty thin. Tensioner when we're doing the extraction with the robotic system, and we fixing it to this ring around the scalp. Right, so this pull the skin and make it pretty tight. So when robot approach the hair, they can penetrate the skin and be able to extract the grafts in their perfect shape. Acquiring the template that we put on the scalp and finds individual hairs and calculates the angles and exit. So basically has a very good map of the follicular units and how they're located and how it wants to approach them. The transplant is pretty safe. It has two mechanisms to extract the grafts. This approach is that a sharp punch goes in very superficially, scores the skin, and right after that a blunt punch rotates and goes in to harvest the grafts. So the grafts are usually being sucked a little bit out of the skin, so when the extractor will remove them, they're going to be easily standing. So as you can see, grafts are looking good. These are singles, one hair per follicular unit. These are twos, these are threes, and those are fours. Basically, we want more hair per graft, the way that hair naturally grow in follicular units. And in this case, you see we have a lot of threes and some fours. Portion or robotic extraction of the grafts on this back of the head. Sides, we do manual extraction. Many patients are responding pretty well in the back with ARTAS, and the back to do manual. So on the sides, the angle of hair is more steep, and sometimes robotic system doesn't detect it properly. Tools to remove the graft is, you know which one works better for each patient. So we are almost done replacing the grafts. As you can see, 3 technicians can place at the same time. We are done with our procedure. So we gave him a little bit more than 2,000 grafts, front and corners. Let's look at the numbers. Let's look at pictures, see how. So this is the head, this is front, this is back. So the corners were filled with good density, middle less density, and the area behind it we put some. Look at the pictures in my camera. This is the front, hairline, corner, both sides, and top. These corners are the areas of maximum density, the whole sides of the corners. The middle a little bit less because he has very solid forelock. And the top areas we put still hair but a lot less dense. Robotic hair restoration day. This is Dr. Mohebi wishing you a happy hair day, and we'll talk to you later.